Hello, everyone. Welcome. Thank you for joining us. As a reminder, we have you muted for our initial briefing. Once the briefing is finished, you can use the Zoom application to either raise your hand for a question or you can type your question in the chat. If you've called in via phone only, you can use *9 to raise your hand. In addition, please make sure to identify yourself by your full name and the organization or media outlet you're from prior to asking your questions. With that, I'll turn it over to County Manager Mike Callagy.
Thanks, Denise, and thank you all for being here on this beautiful Friday, April 24th briefing. I don't have a ton of things to go over here, so we'll try to go through this relatively quickly. So we're up to 989. That represents 23 more positive confirmed cases from Wednesday. Unfortunately, I have 2 more deaths to report, so we're at 41. Those look to be just about evenly split between male and female. And again, the area of concern, greatest concern, is that population 80 and over, which certainly make up the vast majority of those who have died from this disease. On to the next one, you can see that we're doing great. We've got 67 people who are in the hospital, COVID-19 related patients. Sometimes a couple times now I've had people ask about the ICU beds that, we only have 38% capacity left. You can see where the surge beds, we got 96% capacity. And the nice thing about that is a lot of those beds can be converted to ICU beds if necessary. And ventilators are doing great on. The next one is you can see that we're reaching the 10,000, tested in this county. The thing that I'm hopeful of is the average days for results is coming down to 1.88. We'd love to see a 24-hour turnaround. We hope to get there, but we hope to do that simultaneously with an increase in testing. And we should know more about that next week as far as capacity of more test kits on the way and our ability to make sure that we get more throughput at the Verily site and other sites around the county. So next Friday, we hope to have for all of you cases by zip code. And, we will put that out through for every city. We'll cover the entire county. And hopefully we'll have that again by next Friday. What we'll put with that, though, is really the percentage of infection rates that go along with that. So we don't paint an unrealistic picture for those members of every city who might think, oh, I just have a couple here, so we're safe. That is not the case, and we've got to make sure that we reiterate that at every level of a city for them, so everyone will understand that it's highly contagious. Many people are asymptomatic but still spreading, and we will put that rate that we believe is really the true infection rate per zip code. So more to come on that. On the updates from the on health, the Bay Area health officers are really thinking deeply and carefully about what the next steps are in the shelter in place. We should have more information on that next week as the orders expire on May 3rd. And, they'll not only think about the health implications, at least I'll speak for our health officer, but so, additionally, the social and economic implications also that are going on here. But, health is obviously a primary concern. And that's what we've done, and it's been effective. And we got to make sure that people continue to do that and realize that the new normal will be certainly social distancing on a widespread basis as things open up, and certainly probably continued wearing of the mask and washing hands and all those things that'll be necessary, because we don't want to get to the fall and have this spread, like wildfire again during the flu season, or even in the late summer here or during the summer. So we're going to take all precautions necessary to make sure that happens. Let's see what else I have here. The shelters continue to expand our shelter space. So we have the new shelter in Burlingame. We've got 27 people in there right now. We've got room for approximately 40 more there. Our goal is to make sure that everyone who wants a shelter has a shelter, place to go to. We're trying to get those most vulnerable out of the congregate living situation into a more isolated room setting for them, so they will be less susceptible to getting COVID-19. And we certainly have staff there that can check on them and regularly check their temperature and monitor them for signs or symptoms of COVID-19. Okay, with that, let me go to some of the media questions. Any idea how the rent moratorium is going? Any emerging concerns with landlords or renters? I've not really heard anything about this. We really have had very little feedback. We haven't heard of any evidence of any problems. I think that everyone's understanding of the situation that we're faced. But if we had those issues, we'd probably hear from it through legal aid. So we hope that landlords are certainly understanding of what's going on, and that those who need that assistance of a suspension of the rent or deferment of the rent, that they are doing that with the correct documentation that's needed to do that. So we haven't heard much about that. Social services and nonprofits are particularly strained right now and will likely become more strained the longer the SIP goes on. Any emergency weak spots that will need to be addressed. We're continually assessing and reassessing where the needs are. Part of that $3 million that the board gave, $1 million of that went to the nonprofits, core agencies, to really help bolster their operations so they can provide more assistance to the public, which is what they have done, and will continue to monitor that. Really, it's the food needs, the Second Harvest Food Bank, and some of the other areas of support. So that's one means of support that we're utilizing, but there's several others that we also utilize, and even more strategies that we're considering on the food front. We just want to make sure that there is not a food insecurity in this county as a result of this crisis, and we're really making sure that the availability of volunteers are there to help with this, and they've been tremendous. I think we had over 200 volunteers to help Second Harvest at the King Center giveaway in San Mateo. We just had Tracy Weatherby from Second Harvest report that they gave out over 750, or they gave out 750 boxes and were able to feed everybody in South San Francisco that showed up. They have tremendous lines in Daly City, so we're taking a closer look at that. We have established kind of the food czar in our county. We have surveyed the city managers to see what their needs are, and I know that the governor is also looking at additional measures to help those seniors that are sheltering in place and making sure that they are fed. And we will continue to monitor that. Again, remember that we put the food availability response team together. It's headed by Anna Marie Despain, who's our director of libraries. So she will continue to report back on us and work with the nonprofits to make sure that there is enough food out there. Next question, the curve remains flattening. Are there any staffing or other changes anticipated at the San Mateo Medical Center? So the San Mateo Medical Center continues to see a steady flow of COVID-19 patients, including some that require ICU care. And certainly the medical center is meeting the needs of the currently hospitalized patients within the existing staff levels. But given that some patients can be quite ill and require greater assistance, some staff from other parts of the organization are being reassigned to assist. So it's kind of an all hands on deck. And remember, we have suspended the other operations and so on in the hospital that are not absolutely necessary, so that we can make sure that we have availability of doctors and nurses and supplies and everything for COVID-19 patients. So we will continue to monitor that, but we're hoping that they certainly have capacity there now, and we'll probably change some operations in the future to address some of that capacity. As we head into a nice weekend, any concerns or changing plan of action to address folks not adhering to the SIP order? Yeah, well, certainly there's concerns of, again, folks flocking to the beaches or to parks. And the beaches parking lots remain closed. We are asking people to adhere to the orders, and it's getting difficult, right? It's a beautiful time of year. People want to be out and about and want to get on with their lives. We get that, but we do not want to take a step backwards here. The public has been tremendous in their efforts, and that really has saved lives. We want to continue down that road and make sure that we don't start sliding now. I think that we'll see potentially some changes in the upcoming weeks. We do have law enforcement out there, like we did last week, who will take necessary actions to make sure that folks are not congregating and coming out to the beach and using the resources out there. And again, a big factor of that is people coming out and going into stores and eating the food supplies out there and creating crowds. We do not want that. I just ask people to hang in there. Let's get through this together. And it's kind of a once in a, hopefully a lifetime type of thing that we'll ever see. And the sooner that we can all work together and maintain this type of social distancing, the better off we will all be. But there will be brighter days ahead, and there will be an end to this at some point in time. We are just not there yet. Next question. Some cities are opening streets for local recreation purposes. Distancing protocol. Any thoughts on opening county parks again for the same purpose? So here's the problem. In March, we saw masses, even after these stay-at-home orders went into place, coming to the parks from all over the area. And the same thing, utilizing the surrounding stores. There was just crowds in the parking lot and crowds on the trails. And a lot of these trails are very narrow. It's just not conducive to the health and safety and well-being of the general public when that occurs. So that being said, I certainly have been in discussion with the parks, and there are conversations in place and plans in place to reopen the parks. We'll talk more about that next week. It will happen in phases. It's not going to be again a flip of the switch. But it will happen in phases, and it'll be strategic, and it'll be done in a way that makes sense. Including the potential for one-way trails or limited access or limited people on trails, and potentially with starters. Rangers acting as starters to make sure that we separate people and don't have crowds going out at the same time. We might limit some activities on some of the trails to make it more conducive to, say, walkers or joggers as opposed to bicyclists. So those are some of the things that we're looking at. We'll certainly have signage in place and rangers out to help direct people. We understand how beautiful the parks are, especially this time of year, and how people want to get out and enjoy nature, and we want them to do that also. But right now, at least for this, for the foreseeable future, we just ask them to adhere to the orders, recreate within the 5 miles of their home on their sidewalks, streets, or wherever else they can within the radius of their home, and to stay away from other people and to give people plenty of room. And that's what some of these closures of streets are really trying to accommodate people out walking. I mean, it's great to see everybody out there walking. I've never seen so many people out walking and exercising and biking, and it's great to see that. And these extra spaces really help with that, so that you can separate bicyclists and joggers and walkers. I know that Foster City is doing that, and San Mateo has done some of that also. So all those things are good things. We want people to get out and exercise, and it's good for the mental health. It's good for your physical health. So with that, let me stop there and see if there are any questions.
There's one chat question. John Mays, what type of community volunteer response has there been on tracing efforts?
Well, we really haven't put that out, and this is what we're hesitant. This is why we're hesitant hesitant to do that, even though that we may consider that at some point in time, depending on, what our needs are. And I expect, John, that our needs will be long-term, probably for, could be up to a couple of years. And I feel that, we're going to have to look internally at our business here, model here in the county, and maybe create a new department of tracers, or at least augment those contact tracing efforts that are underway now. I think we have 40 or 50 people doing it. I potentially need 3 times that amount or more, depending on how quickly it spreads and how prevalent it becomes. But I think that we're going to have to look internally to do that, because we're going to need it probably full time. And a lot of these folks, I think a lot of these volunteers have volunteered because they're off work right now. And as we get ramped up and start getting a segment of society back to work in the future, I think we may lose out on that. We need consistency. So we'll probably look internally, but to the extent that someone can commit for a longer period of time, I'm not precluding that from happening.
We have a raised hand from Henrietta J. Burrows from EPA Today. You're unmuted.
Yes, thank you. The curve in California might be flattening, but it doesn't seem it's really all that rosy. Governor Brown said this week that there were more deaths in California that occurred this week from COVID-19. And I think you said orders expire May 3rd. Is that the shelter-in-place order?
Yeah, that's the shelter-in-place order I was referring to.
So what do you foresee in terms of public reaction? Do you think most people will go out and attempt to conduct business as usual? Masks will still be required, and people could still be cited.
Well, Henry, it's a good question. It looks like some of the surveys, at least show that a large segment of the population, I think it was over 80% of the population, think that we should continue with shelter in place. People are scared, and I think that people are going to be very, very cautious about. And maybe that was wrong. Maybe it was like 80% or something that wouldn't go to a restaurant and eat. But there's a large segment of society that thinks that we should continue to proceed cautiously and really take this one day at a time. And I think that there's a lot of truth to that. I think that we're going to have to really watch what occurs as we start to loosen up society. It's really that dance that we talked about in the past, that you don't want to loosen it to the point where you have to potentially shut it down again someday because it gets rampant and you don't have the beds to care for the people. This has been very effective, but what it's done is it's prolonged. We didn't hit the spike, which is great, because we would have had major problems had we done that. A lot of people would have died. But what it does is when it flattens the curve, it prolongs the curve. And, it's looking like, right now, and I'm sure that the folks here will run the numbers again, but right now it looks like July or even beyond that we hit our peak or surge, time. So it prolongs it. So it's still out there. And depending on how people react to this and the behavior, and we're going to, depend a lot on the social contract that exists with people to understand that we're all in this together and need to really protect ourselves and protect others from this by adhering to new norms. And those new norms will be social distancing and probably wearing masks and making sure we wash our hands and different way of conducting business in lines and shops and the way that we go about our normal business until there's a vaccine or until there's a viable treatment for this.
One follow-up question, if I may. Will restaurants and public places be required to have social distancing of 6 feet?
I think that's a good bet. I don't know what the specifics are yet, but I would imagine that, we're going to have to maintain social distancing in society. And I don't think that there would be an exception for restaurants or anywhere else. I think it's very difficult. And it may be to the extent that, at some point in time, if you can't do that, then you're not able to operate. I mean, I don't think you can do that in large forums where, you know, you've got concerts and large sporting events and those type of things. I just don't think you can do it. So I don't know, you know, if that will preclude them from operating, but I think that would be a place where things could really spread if you didn't take the necessary precautions of space.
Thank you.
And then another chat question from Emily Miebach. Belmont is asking everyone wear masks while using the town's trails. Do you think that's a possibility for gradually reopening the parks? Sort of addressed it.
I mean, for us in the parks, you know, it certainly is an exemption in the order for wearing masks when exercising because of I'm sorry, but face coverings. Yeah.
But encouraged.
Strongly encouraged.
We encourage it if possible.
Yeah, it is encouraged if possible, and I think that's what certainly Belmont is doing to the extent that you can, and not, you know, pass out through heavy exercise or whatever. You know, it's good. It's always good to have that on because what it does, it protects others from you that you might be passing. So anytime you can wear it, it's encouraged. It's not mandatory when exercising, but certainly encouraged, and for good reason. So we would likely, you know, do the same thing, and I think that people would. I think people on the natural. I see a lot of people out exercising now, and some are wearing it, some aren't. But it wouldn't be a requirement for us, as I sit here now, to open the parks.
I believe those are all the questions.
All right. Listen, everyone, have a great weekend. Stay safe, stay healthy, and we will be back next week.